spend some time talking about the difference between breast augmentation with implants versus breast augmentation with fat. There's a couple major differences between those two things. The beauty of an implant is you can come in, have a consultation, and then we size you. So you put on a bra and we take different sizes of implants to get a good idea of what you're looking for volume. And it's pretty exact. You choose a ballpark volume. It's my job to make sure that it's the right implant for your body and your shape and your size. And as you can see, this is just one implant company, and these are just smooth, round silicone implants. And there's over 200 different sizes and shapes to make sure that it fits you well. Fat is a little different, is that it requires having a good recipient site and a good donor site, and it depends upon the metabolic activity of the patient having the surgery. So it's a little bit different for someone who's 25 versus someone who's 65. How I think of recipient site for breast augmentation is if someone has very small volume of a breast, there's only small areas of place that we can actually put that fat. Whereas with an implant, we decide we want 300 cc's of volume, we pick the implant, we place that either under the breast tissue, under the muscle, and you get that volume increase. But if someone has a very little amount of breast tissue, there's only so much fat that will take in that area. And when I say take, I mean the fat cells have to be transplanted from one place and then be able to survive in the new place. And for that to happen, they have to have blood supply all around them for them to grow and survive and maintain volume. So you can imagine if there's only this much space to get those cells to survive, there's only so much volume that can be put in. So there has to be tolerance from the patient's standpoint to kind of, take what they can get in a round of fat grafting, and it might not be the volume they're looking for. The idea of fat grafting is super appealing for a lot of people. You get to use your own material, create your own volume, and then you get to keep it forever with minimal maintenance. But it's the way that it's not like an implant is if we decide on sizing somebody that they want 300 cc's of volume, if we decide on an implant, we put it in and it's yours and you have it. With fat grafting, you can't just take that 300 cc's and put it in there all at once. So that can be the disappointing part, is it seems like you should just be able to put in the volume that you're looking for. But that's the issue with it, is you have to have enough of a recipient site and a good blood supply for those fat cells to survive over time. So maintenance for both procedures, everybody needs to be getting a mammogram every year over the age of 40. Physical exam is super important in both cases. But implants, we expect the average lifespan to be 10 to 15 years, whereas with fat, whatever fat you get, however that volume increases from the procedure, is yours forever. So you can imagine that as life changes, people often have, weight changes over time, either increasing or decreasing their weight. The breasts kind of go with you if it's your own fat. So if you gain weight, your breasts will get larger. If you lose weight, your breasts will get smaller. With implants, it's a static volume change. A static volume of implants. So the implant's going to stay the same no matter what happens to your body, but your body does age around it. So you can see that there are pros and cons, even for the decision of what kind of volume you're looking for, and then also what kind of maintenance you're looking for in the long run.